COVID-19 variants in parts of the world has changed the pandemic and has raised questions on whether people are now more at risk of getting sick and whether coronavirus vaccines still work. Detecting these variants is crucial to the pandemic response, and here in the country, the responsibility falls on the Philippine Genome Center. Behind this facility is a woman, Dr. Cynthia Saloma. Dr. Saloma and 3 other female colleagues established the center in 2009, not knowing that in about 10 years, the facility will play a major role in dealing with the health crisis. UPPGC was the first to sequence samples and help create the UP COVID-19 test kits and was key to measuring how wide the infections have spread. The center was also the first to discover the UK variant from Dubai.
It's amazing to note that the country like the Philippines was the first one to observe and to broadcast that we have a case from Dubai.
A quiet and private person, Health Undersecretary Maria Rosario Vergeire, suddenly found herself in front of the whole nation as a key figure in fight against COVID-19.
All of a sudden, everybody was calling me, even in the wee hours of the morning, even during weekends. I need to always step up and give information and has to answer all of these questions. So I think that's something of a challenge to me because this kind of shift has affected a lot of dimensions in my life, including family, of course.
Aside from being the agency's spokesperson, Vergeire also leads the department's work against fake news, managing COVID-19 data and surveillance. She's also tasked to call on experts for their take on the situation. The threat of the virus can't be more real than it is to doctors and frontline workers. But Dr. Minette Rosario continues to fulfill her sworn duty.
Within yourself, you're worrying about a lot of things, but you have to show people that you know what you're doing.
As an infectious diseases specialist, her expertise is needed to prevent transmission in hospitals, in taking care of COVID patients, and in keeping health workers from getting sick. She also helped craft the guidelines for adult immunization.
One of the challenges also is maintaining the drive or enthusiasm despite the physical exhaustion. My stress relievers for all these are, I went into gardening, watercolor art. I also know my limits and ask for help when I have to. And I tell people frankly if I can or cannot do what they ask of me.
But what keeps these women going despite the exhaustion and dangers they face in their jobs?
I love what I do. I want to help.
So the most fulfilling thing for me is really to be part of this pandemic. Training all these people have meaning. And for many other young people, I think now they have begun to look at science that makes a difference also.
I had been in public service for almost 23 years now. Seeing the fruition of all of these tasks that I do gives me that contentment.
How long the country would be in these dark times, no one knows. But it is a relief that there are women like Dr. Saloma and Rosario and Undersecretary Vergeire who continue to shine a little hope to an entire nation. Caroline Bongkin, CNN Philippines.